What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering Xray Tech versus the nuclear medicine technologist, the nuke med, if you will. So to give you context, I am a night shift Xray Tech. I'm doing it for 4 years and also dabble in the day shift because of overtime. So Xray versus the nuke med, both are in the realm of the radiation, but the complete opposite level of radiation. So essentially in X-ray, we are giving the patient a small dose of radiation, especially just for X-ray, like the basic films. Compared to fluoroscopy, you get a little bit more. In nuke med, we give the patient, depending on what they do, you give them isotopes, so you're injecting them with radiation. And imagine you have inside, like, your body gives out the heat because, like, your body's naturally hot, so like you feel like your hand is warm, so your body's just emitting out radiation. So depending on what they're trying to see, the different kind of isotopes they'll give you. Certain ones are slow acting, some are fast acting. Some of them require you to take a fatty meal / sometimes they give you like a little protein shake up there to drink to admit that, for like gallbladder, for certain different stuff that they're looking for. Sometimes certain exams you'll have, like, where they'll inject you and then they'll have you wait outside, which, I mean, it's not the most ethical thing because technically you are admitting small level doses of radiation constantly, but that's what they do. Some of them will have you wait a few hours till it gets into your system, and then they'll bring you in. And essentially for the nuke med, you'll lay down on a table and there'll be a receptor that absorbs, well, not absorb, but like can kind of detect where the radiation is coming from, and then it will show up on the screen. It is very grainy. From when I was a student and I was going through their modality, it is very grainy. It is hard, especially if you're not certified in that. It's hard to tell what you're looking at sometimes, because, like, being a student compared to, like, to X-ray, where it's like very crisp, and then if anything's blurry or the patient was breathing or it's unoptimal, you can kind of tell, like, it looks kind of fuzzy and stuff. But like on that one, being a student, it literally looked like we were doing on 144 like pixel type like quality. It was like very low rendered, and it was hard to tell because, like, the technologist who led me through a little rotation was like, "This is a gallbladder," and I was looking at it and I was like, I'm be honest with you, I don't know what you're looking at. And he had to like whoop out one from the internet, and it was like you could tell the outline in, like, that's part. They'll do that. They do a bunch of heart stuff. Certain technologists will focus on the cardiovascular side, so they run several tests, several stress tests, several other modalities like that. Those technologists wears what I call the Green Lantern ring, because you're handling the isotopes with your hands. So, like, you wear a little ring on your hand that has, like, the radiation, because, you know, you're handling, which they constantly get constant levels of isotopes, like, brought into them because they're very time sensitive, depending on how much they have going on. I've seen, because, like, to order it, and there'll be a special person come in with, like, a brick that contains lead that carries their isotopes. And I'll see them come in when I was a student, like between, like, 3 all the way to 5 times. They'll come and do those. They'll bring them in. So, and then especially, like, where they get stored, it's like in a giant box just filled with lead. It's pretty cool. So that's what they have going on. Us as X-Ray Tech, we just wear a little thing around our neck, and if you're pregnant and you have a baby, one around your tummy, those tracks your radiation. In X-ray, we just do, well, what I do is basic, just film X-ray. So I go around doing chest X-ray portable in my trauma 3 hospital. There is also the fluoroscopy side, where you can do enemas, you can do LPs, you can do esophagograms, you can do myelograms. There's various different kind of stuff you can do. But I would say that nuke med is higher up in the chain of the radiation world, because you have to become a basic X-ray tech first, and then you continue on to 2 more years or a year and a half, depending on the program, of continuing education for those. So of course you're going to get paid more because higher level. But I would say, when I was talking to some of the techs and just looking at the outlook, there's very, very less jobs, like way less jobs for them, because usually, like, there's not that many, like, positions available for them. And then as far as like working overnight, that doesn't really happen. It's more of a during the day kind of schedule gig. In my 4 years of working at the hospital, only one day have I seen one of them have to get called in to do the actual X-ray. Their exams overnight and had to get read. So if you don't like to being called in, that's probably the gig. Them and the MRI people don't really get called in that much unless there's like a brain bleed. And I mean, of course, I would say I think their starting pay is like 35 to 40 depending on where you work. And it's like a kind of a Monday through Friday gig from what I've seen. As far as school goes and everything that goes behind it, I'm not quite sure. I'm not certified there. I'm just telling you based off of my experience and what I've seen and some of the more basic knowledge. If you're like, Miguel, would you do it? I'm more of a CAT scan type of person. That's what I'll be pursuing in my endeavors. I'll be pursuing CAT scan, because CAT scan is like, it's like the closest resemblance of X-ray, because they kind of do the same position, and except it's like they do a scout picture which shows like the basic, like a chest X-ray, and then imagine you just do a 3D rendering of it, the slicing and stuff like that. So I could see that one kind of gets my attention as far as that. And there's very, like, in Texas, the closest one we have is like, because I live kind of in East Texas, so like my closest one would have to be out of state or all the way down to like, I think like Texarkana has one, and then the other one is like all the way down in Houston. So it's like very, very niche schools that have it. But yeah, it's been your boy Miguel. I hope you enjoy these videos as I continue educating in the world of radiology, because if you go on the internet and on the YouTubes, you will barely find any videos. And I cover very niche topics to help those who are up and coming in the radiology world. Because when I was a student, I was like, I wonder this very niche question. And sometimes, especially if you're a student, you don't want to bother your techs, you don't want to ask them questions. I'm here to give you this very niche knowledge to help you become a better tech, and for you to never know, like to ever wonder some of these very niche topics, because I feel it's my responsibility as X-ray tech, because I would give anything for someone to give me all this knowledge when I was a student or when I was in college, because there isn't that much to know, like that much knowledge out there for our field to begin with, compared to like if you look up nurses and doctors and other medical fields. So I'm just here giving you the knowledge, and I will continue doing this as long as I can. And right now I'm constantly posting, because every little idea I come up with, I'll like post, and I'll give you videos and updates on that. And yeah, if you enjoy, hit that like, hit that sub, and see you on the next one.